We'll go ahead and get started. Those that do not know me, my name is Ali Tenhagen, and I am the Director of Lab Services here at Forum Health and for Power to Practice. And so today I'm super excited to talk with you guys about our new partnership that we have with a company called Evexia Diagnostics. And we do now have a supported full integration with Evexia Diagnostics through Power to Practice, which is what we will be reviewing today. So I'm going to go ahead and share my screen, and we're really just going to walk through a demo of how can you set up this integration in your Power to Practice account. How can we configure labs in your specific Power to Practice clinic portal so that you guys can ensure that you have all the labs set up that you need. And then we'll also review how to actually order through the integration as well. And Stephanie and I see another person here joining. If you guys can give me another thumbs up that you can hear me, I'm getting a couple feedbacks from some people that they cannot. So I just want to make sure that you guys can definitely hear me before we proceed any further. Awesome, perfect, we'll keep going. Okay, so let me share my screen with you guys and we'll get started. And if you guys do have any questions, there is a chat channel that you can throw any of those questions in as we review this. We're gonna save plenty of time at the end to review any questions that you guys do have throughout the presentation. So feel free to just put them in there and we'll pull those up towards the end. Okay, so let's dive in. Okay, so if you guys can see my screen here, I have my Power to Practice account pulled up. And so we're kind of review. I'm in my HCP account right now for my Power to Practice account. And so the first thing we're going to review is once you have this set up for your clinic, how can you configure your labs that you want to have available? And so you can do this in two ways. You can do it both through your HCP account for your clinic, and you can also do it through your admin account as well. And so what we'll do, since I'm through my HCP account, is we will go to that admin section. And then the first thing that we're going to go to is lab companies. And so once we have this page populate, we have this new search bar feature here that makes it very easy. What I would suggest doing is you can just simply type in Evexia in this box, and you can see that it will now pull up all of the Evexia labs that are available through this integration once this integration is set up for your practice and clinic. And so you're going to see the list of the name or the list of the company name first, and then you'll see in parentheses Evexia listed afterwards, which will indicate to you that that is the specific Evexia integrated lab company that you are selecting. So you can see all of these are listed in alphabetical order. Any lab company that Evexia Diagnostics does offer on their platform, we do have available through our Power to Practice integration with them, along with any individual tests and panels through each lab company. And so from this page, what you'll do, and you can see I have a few already favorited, but you'll go ahead and just favorite all of the individual lab companies that you want to have available in your lab formulary to choose from. So these are all editable. You can change these at any time if you decide to no longer use a lab company from Evexia or add in a new one at any point. And so from here, what we can do, I'm going to actually go to this LabCorp Evexia option because I think that's one of their most widely used options. And from here in this page, you can go to a couple different tabs. So the first tab that we can go to is this lab test setup page. And this will show you the list of all individual lab tests and panels, if we click on the panels option, that Evexia offers through this particular lab company. So you can again see these are all organized by alphabetical order, multiple pages of those. And then you can also easily search within here too if you're looking for something in particular to see which tests are available through this particular lab company. I believe from LabCorp, to give you guys an idea, they offer about 1,500 tests from LabCorp that are the most commonly utilized tests from LabCorp. And then for all of their other partners that I would consider their specialty partners or other companies like Access Medical Laboratory, Boston Heart Diagnostics, and so forth, they will be offering every test available from those companies. So the next tab that you can go into from here is we can go to that lab order setup page. So this would be where you will organize and configure the particular lab settings that you want to have set up for your clinic. So again, you can see I already have some tests available in here. And again, this is a very fluid page. So you can change any of these selections that you make at any time. So let's say for whatever reason, I no longer want to have this particular panel or test available in my commonly ordered test section, I can easily remove those if I want to. And then again, if I wanted to add any particular tests, like let's say I want to add dihydrotestosterone, I can easily add those to my list. You can move around each of these tests into any configuration that makes sense for you that you want to customize. Or if you would like to use our alphabetical feature, you can easily just select the alphabetical option and it will alphabetize all of your commonly ordered test selections as well. So once you make those selections, you can easily click save. And then the other thing that you can do is you can go to this test group section here, and we can now set up individual test panels or test groups if you like to order some of these commonly ordered tests in certain combinations. So you can see I have some very common ones set up here that you might also want to have for your clinic. For example, I have a thyroid panel, I have a hormone panel set up, and then I have an initial panel set up if let's say I have the same initial panel that I want to use for all of my patients. So you can easily add in any new panels that you want to have available in here. So I'm going to do, let's say, a new patient panel, and again, easily select all of those tests that you want to have set up for that panel so that these become easy one-click options for you. So very similar to how your functionality of ordering and setting up labs looks like today in P2P. And then again, always make sure that you're saving these options so that all of your configurations save in your P2P account. So that's what it looks like for configuring some of our LabCorp tests. So now I want to show you some of the specialty tests just because sometimes those look a little bit different. So once I now select, let's say we'll select diagnostic solutions, for example. Same concept here. We can really search any test that they offer from this particular lab company. And then again, in here, let's say, for example, GI map, I know is probably one of the most commonly ordered tests from Diagnostic Solutions. So we can easily search those, add them in here. So once we've made all of those selections and we've decided which particular tests and combination of tests, panels, and lab companies that we want to have set up for our clinic, we can now go into a patient chart. So I'm going to go to a test patient that I have set up here. And same way that we would order any labs today, we'll go down to the test lab test option under ordering at the bottom left of your screen. And then from here, we'll now select our lab company options. So you can see all of those lab companies that I've already decided to add as my favorites are now showing up here. And then of course, any others that are not necessarily part of our Evexia integration that you may previously have favorited in your list will still also show up. So you'll see both options now. And so again, we'll start with the LabCorp order since that's typically the most commonly used lab company from Evexia. And we'll walk through a LabCorp order for a patient. So once we make that lab company selection, you'll see that we have a handful of additional options that we'll now have to pick from. So the next option will be provider. So if you have multiple providers in your clinic, you can now choose which particular ordering provider that you want this lab order to go under. You now will have to select your date to draw option. So it automatically defaults to today's date of February 14th, but you can post date that lab out to as far out as you would like to if you want to change that date. And then this selection of bill to is going to be a required selection that we'll need to select when placing the order. So it's going to default to nothing, and you'll want to select from one of two options. So you're going to select either patient pay or practice pay. And this is how you're intending Evexia to bill this order. So if you select patient pay, that means that Evexia now will bill your patient directly for any testing that you order in this order, and you are not involved in billing whatsoever. If you select practice pay, which we'll select for this example, that means that you want Evexia to charge you as the provider or the clinic for the cost of testing that you order for this particular order. So it is important to note that you can toggle between the two bill to or payment options for each order that you place. The next selection that we'll make here, again, defaults to nothing. Not all, obviously, testing that we might order through this integration from Evexia does require a blood collection. But for LabCorp, most of their tests do. So in this selection, we'll want to choose, do we intend the patient to go to a LabCorp patient service center? Do we want Evexia to help support our patient in locating a mobile phlebotomy option that would be close by them? Or are we going to draw this patient's order in our clinic? So you'll just want to make one of those selections so that we can have that be placed on our order for our patient. And then again, if you do have multiple providers set up in your Evexia account, we'll make that provider selection here. For this purpose, we do not have additional providers, so we'll just keep it to none, which will default it to myself as the ordering provider. So once we've made some of those selections here, again, you'll see all of those, configurations that I just walked you through, how to set up your commonly ordered tests, and then test group or panels will populate for each of those lab companies that you have set those configurations up for. And then you can also still live search for any additional tests that maybe are not in this list to add to any order. So let's say for this particular patient, I want to order my thyroid panel for them. You can see all of those tests that are included in that panel will now populate up here at the top, showing you that those are what you are intending to order for your patient. And then what's really neat is you can actually hover over each of these tests and you can see the full name of that test, the LabCorp test ID for that particular test that you're hovering over, and then what Evexia's provider or practice price is for that individual test. So you can see that information for every single test that you have set up in your commonly ordered test section. And then once you select multiple tests for an order, you can see this Evexia subtotal comes up down here at the bottom of your test selections. And that is going to indicate, the total of all of the tests that you've selected and what the practice amount will be for those. So once we've decided we've selected all the tests that we want for this patient's order, from here we have two options. We can either just save this order if we would like to. Maybe we're not ready for whatever reason to order this today for this patient, but we want to have it as a pending lab order in their chart. So we can do that. You'll have this PDF pop up that gives you just kind of a draft, if you will, of that order. It'll have your practice information at the top up here. Obviously, no requisition or account number will generate because we haven't actually placed that order yet. All of your patient's demographic information will populate in this section, which will be pulled from their patient chart. Any diagnosis codes that you do have in that patient's chart will populate here, what our billing selection was for that particular order, and then of course the lab company and all of the individual tests with their individual costs that you've selected for this patient's order with a total at the bottom. You'll also note that we have a handful of disclaimers down here at the bottom of the PDF. So I'd encourage you to just take a peek at those, but just outlining, additional charges that could occur for draw fees if a patient's going to a LabCorp patient service center, reflux testing, and all those sorts of things. So now let's say we placed that, if you will, pending order. So this is where it shows up in our pending lab order section because we created a draft. And now let's say I'm ready to go back in and actually place that order for my patient. So I can click on that date to draw. It is a live link. It'll pull that order back up From here, you can edit this order if you wanted to. So you can still have the opportunity to add additional tests to this order, remove any tests from this order if you wanted to. And then once you're ready, we can actually place order for this patient. I'm getting those pop-ups just because I did place a previous order already today for this patient, just for everyone's awareness. Again, you'll get that same draft of that order pop up, so exact same PDF, if you will, that we just reviewed before. And then what you'll do is you'll go back to your patient chart and you'll now see that's no longer a pending lab order. We have a true requisition number available here for this patient's order. And then it typically takes, give or take, about 20 to 30 seconds for this order to send through to Evexia's system and for the requisition form to generate back in your P2P chart. So once that 30 seconds does go by, what you'll see is this PDF icon that will pop up here in the pending lab order section. That is a live link that you can actually click on, and it will pull up the actual requisition form and lab order form for your patient that they would either use in office if you're completing that draw, or like for this patient, we sent this patient's order to the LabCorp Patient Service Center. So this is what that requisition form will look like. Again, very similar to what our draft looked like, and very typical requisition lab order form with all of the necessary information and tests that you've selected to be ordered at the bottom. From here, like I said, you can pull up that PDF in a couple ways. You can pull it up from that pending lab order section here, and then that PDF requisition will also save in your patient's document section as well, so that patients can pull this up through their patient portal as well. So that's how we would place a LabCorp order for our patients through the Evexia integration on Power to Practice. A couple of things to note is for that order, if you remember, we did select practice as our bill type option. So something that's going to be a little bit different if you're choosing to select patient for that option, for if you're wanting Evexia to bill your patient directly. Let's say we're going to order that same exact thyroid panel for that patient. So we have that subtotal show for $47. Again, keep in mind, this is the price for providers if providers and practices are paying for the order. If you are choosing patient as your bill to type, there will be an additional 3% service charge added on to your patient's total when Evexia does bill them. And so that's part of that disclaimer information that we have on our PDF here at the bottom, so that patients are aware. And then the other piece to this is when we do actually place this order for a patient pay order, you will still see that that order will pop up here under the pending lab order section, just like our last order did. If I can refresh my screen. Oops. So you'll still see that order pop up here, but what you won't see is that actual PDF icon pop up, and that patient won't be able to access their lab requisition form until the patient has paid for their order up front. So when you've selected patient pay and Evexia is charging your patient directly, what will then happen once you place that order is instantaneously your patient will actually receive an email directly from Evexia on whatever email address they have on file in their P2P chart. And the email will look exactly like this. So it'll welcome the patient to Evexia Direct. It'll give the patient a username and temporary password for them to go ahead and sign in to create a patient account with Evexia Diagnostics. It'll walk them through all the steps necessary to do that, provide them with the link. And then once the patient logs into their account is where they would have the opportunity then to pay for their order. And like I said, once the patient has paid for their order is when Evexia then releases and makes the lab requisition form available for them. And the patient would be able to access it both in their patient Evexia portal along with it will also then populate in that patient's chart as well, just as it would for practice pay options. So those would be the two scenarios I would say for a LabCorp order. And then if we want to, we can walk through a specialty lab order, because those are going to be a little bit different. So as most of us know, for most specialty labs like a Genova lab, a Dutch Test, a Diagnostic Solutions, ZRT, whatever company it might be, for those specialty tests, we actually get a physical test kit with all of the necessary collection materials and instructions that then gets sent to the patient to complete the testing and order. So when we're placing an order for a specialty company through the Evexia integration on P2P, we'll still have all of these same selections that will pop up here. We'll still want to also select what bill to option that we want to select. Let's say I'm going to order a stool test for this patient. Obviously, no blood collection type is needed for that, so we'll keep that as blank. I don't have any particular commonly ordered tests set up here, so I can easily just search for the test that I'm wanting. So let's say I want to order a GIFX stool profile. I can select that as my test that I want to order for this patient. Again, you can click save or order. Once we click order for this particular test and any other specialty tests, you'll have that same PDF pop up like we got here, indicating what it is that you ordered and the cost. That lab order, you can see, will then pop up in your pending lab order section so that you know that you've placed it. From this point on, though, what Evexia is going to do is they're going to coordinate with that lab company that you've ordered this test through to directly send and drop ship this test to your patient on your behalf. So really nothing else is needed on your end for this. So it's very easy for both you and patients to now order from these multiple different specialty lab companies, all in one platform, all through Power to Practice, and they will take care of all of the logistics of shipping that test kit to your patient. So once we've done that, what you can do is we can actually then go on to our Evexia account. So this is what my test account looks like for them. And all of those orders that I placed just now that you guys watched me place, I sign back in, give me 1 second. You can find all of those orders in your Evexia account as well. So all of this information updates instantaneously, and you can keep track of really any of those orders if you wanted to, or to ensure that they were placed on your Evexia account. So you can see those 2 LabCorp orders that we placed, requisition ready, so you can access that requisition on Evexia site if you wanted to as well. It'll tell you if that order has been collected by your patient yet, or if that's still pending. If lab results are ready for that particular order, although those will also become automatically available in P2P, just as any other bidirectional lab results would be in our system today. And then what I like this feature for is for that Genova specialty kit that we placed up here at the top. Once Evexia ships that kit directly to your patient, like we talked about, a tracking number will actually become available here so that you and your patient can track when to expect that test kit to arrive to them. So this would be a good way for you to be able to, like I said, keep track of those specialty kit orders. We do also see here for our LabCorp order that we placed that rather than practice pay, we did select to have the patient pay for that order. Again, they'll give you just kind of a status check of they did send that order to your patient for the patient to pay. However, the patient has not yet paid at this point. The specimen status will switch to patient pay once that patient has paid for their order. It's also important to note for that patient pay selection. Like I said, Evexia does send that email inviting patients to set up their patient portal and to pay for their particular order. If a patient does not pay right away, which we know is very common, they will send concurrent emails to your patients reminding them that they do have a pending order from your practice and that they do still need to pay for that in order for that order to become available for them, or for Evexia to facilitate shipping that test kit to them if it is a specialty test kit. So that kind of reviews a lot of the steps in terms of different ways that we can order tests through this integration for Evexia offered tests. And so now when it comes to results coming in, what's really neat with this integration is just in the same way that we now have the ability to order from all of these 30 plus different lab companies all in one platform within your Power to Practice account without leaving your EMR. The same is true for your results. So for any of those lab companies that are offered from Evexia, all of those results, once they are ready from the lab company, will also become available automatically, just as any of your other results would become available within P2P. So you'll see them show up here in your test results section, and then also they will populate into your patient's chart as well. And I think that is everything that we wanted to kind of review today for how to set up your labs in the Power to Practice environment for Evexia integrated labs, as well as how to order. And so if you are not currently a Evexia customer and you like kind of what we went through today and you would like it to become available for your practice, step one of what you would want to do after this webinar is we would want to go on to the Evexia Diagnostics website. So it's just simply www.evexiadiagnostics.com. I have it pulled up here, and then you'll want to click this clinician sign up tab. And so it's going to take me here because I'm logged in. So let me log out so you can see what that would look like. So that would be step one. It takes literally 2 seconds to set up an account with them. I apologize. I don't think it's going to let me do it because I already have an account set up. But it takes 2 seconds to set up an account with them, just standard information that they're requiring: name, clinic name, provider, address, all that sort of information. We do request that you put in our referral code of P2P when setting up that account if you are a new customer. That makes it easier for us to integrate that account with Evexia once you're at that step. And then once you log into your account, it's super easy to provide our customer service team with the necessary information to integrate your account. So typically takes, I would say, about 24 hours for Evexia to set up your account. Once you have it, this is what your dashboard will look like for them. From this point, we will go to the tools option, and then we'll hover down to EMR integration, and we'll select that. From here, you'll see all of the different EMRs that they do integrate with. So you can see Power to Practice at the top and in the middle. If you do not have an integration already set up, you're going to see this Enroll Now button come up because our practice already is integrated. It has switched to Manage Integration. But regardless, once you agree to their terms and conditions of setting up the integration with Power to Practice, essentially just giving Evexia Diagnostics permission to share your account and patient information with Power to Practice, this is the screen that you'll see. And so really it shows an API key that you can easily screenshot this page or copy and paste this API key. And that is what our team needs if you want to submit a ticket into our P2P support team. They just need their API key and what email address that you have on file with your Evexia account to simply make that integration active and available for you. There is no cost to have this addition or this integration available for your Power to Practice account. It is completely free as an add-on if you choose to have it. So that is worth noting. But I think that's kind of everything that we really wanted to review today on this demo. So I'm going to stop sharing my screen here. and see if we have any questions in the chat. So again, if you joined halfway through or had just popped on, if you do have any questions, feel free to put that in the chat. It looks like I have someone with their hand raised. Unfortunately, we do not have the capability to have someone come off of mute during this webinar. So our chat feature is going to be the best way to ask any questions that you guys do have. We'll give it a few minutes because it looks like someone did have some questions. Okay, maybe we do not have any questions. Perfect. Alrighty, well, I don't think we have any questions coming in. So I appreciate everyone's time joining this webinar. If you guys do have any questions that come up after the fact, please feel free to reach out to either our P2P customer support team or our P2P sales team. They're more than happy to answer any questions that you guys might have. And we can also get you guys set up with a one-on-one demo. If anyone has interest in really having a more one-on-one setting for a demo for this feature, we can do that as well. But again, I don't think I have any questions in the chat. And so I think we are good to conclude here. Again, to remind everyone that the recording will be available for everyone that was on the attendee list. So you guys should be getting that shortly here once we conclude. Perfect. Alrighty, I appreciate everyone's time and hopefully this was beneficial for you. We will have another one of these next Friday. So if you did find this valuable and you would like to join for the next one, keep an eye out for the next invite for that coming through your email. Thanks everyone.